Welcome to the Etobicoke Lakeshore podcast. It's related directly to something if you are in our neighborhood, and I think you might be. It's called the Etobicoke Lakeshore Press. It's run by a guy named Roger Tuminieri, who joins me today with a very nicely cropped beard. Man, you are looking like ready for things to open back up here in Ontario.
I'm looking a little better.
Wow,
a little bit more streamlined.
Yeah,
yes.
I hate to say supermodel because it's not suitable, but let's just paint the picture that you've really cleaned it up for.
Yeah, we'll just call it
summer.
super.
Super. That's a good point.
Yeah, that looks super. Thank you.
Thank you for joining us. Don't forget to subscribe wherever you're listening to the podcast, and tell a friend about it if you're in the neighborhood here. You're going to meet some great guests along the way on this show that are from right here in South Etobicoke. Mimico, Long Branch, New Toronto. What am I missing?
Alderwood, the Queensway.
The Beeline. Okay, you got another one? You said Alderwood already?
I said Alderwood.
Sunnylee, the Kingsway.
Can't forget the
if you go a
Kingsway.
bit more north.
Hey, see, that's why we bring in the neighborhoods, so that we can name the neighborhoods themselves. That, by the way, Dr. Tim Kodsi, and he is from Mimico Medical, the guy behind the vision there, and he brings with him a guest today that's very important to a discussion we should all be having ongoing. And we'll get to that in a minute. First of all, I wanted to touch on something, Roger, if you don't mind. And Tim, you can chime in on this because you were part of the fun. A bunch of us got together and put on a little bit of a, how do I put it? A little bit of a show of love and action in a time where we all felt a little bit inactive, a little bit under the pandemic button, as it were. And a bunch of businesses got together to put a truck on the road and the message out there into stores and onto billboards saying, I heart EL. Tell me about this thing and how it ended up and why it began. And it relates directly to what we're talking about today.
Absolutely, yes. The I Love Etobicoke Lakeshore campaign, I think if I'm honest, Mike, it probably started right when the pandemic began. You and I got together and we started to do podcasts twice, 3 times a day, just to try to reach out to local businesses in South Etobicoke, make sure that they knew that we were there for them, try to help them out as much as we could. Most of whom had to close down for no fault of their own. Fast forward about a year or so, I suppose around Valentine's Day, we came out with this campaign called I Love Etobicoke Lakeshore, the I Heart EL brand, if you will. And the idea was to just show messages of love and encouragement to the community, help support local businesses. James Maloney, the Member of Parliament for Etobicoke Lakeshore, was behind it, as were a bunch of other local businesses, including Mimico Medical. Everybody kind of, put their money where their mouth is and supported the campaign. And it's had a couple of iterations since then. We had another campaign run right before Easter. And now that one was in support of Women's Habitat of Etobicoke. And now we're going to start another one later this month in support of mental health awareness, as well as youth mental health awareness. And so we're in the process of getting a lot more local businesses on board. And it's perfect timing because it looks like we're going to be going back to business shortly.
And it's interesting because we all think that this is a time where it's going to open up and everybody's going to be back to feeling great again. Meanwhile, I think that there's, a bit of a transition that will take place. We're going to have to stage this out properly as a province and as a nation. And by the way, James Maloney with his very own podcast out shortly, and he addresses this from a federal government perspective as well. If you want to know how things are going to be getting back to business, some of his ideas come out in his first podcast to the community. But as we put this together and talked about it as a group, I think that it really did begin with an effort to stave off feeling helpless, to remind each other that we're there for one another and that we're still here. I'm not seeing you on the street. I'm seeing you on Zoom, but we are still here, a community. And so I really love taking part in it.
Yeah, it's a wonderful campaign, and more people are coming on board. We did it for 2 days at a time, and now the idea is to get that truck on the road 4 days a week, every week on an ongoing basis.
Okay, so as we head into that, today's guest, a regular on the show, is Dr. Tim over here. He's sort of our go-to guy. In fact, I'll tell you just an aside, on the weekend I had to text him. I've been bit by a tick, man. What do I do?
I told him, call me on Tuesday.
Yeah, he said, don't panic. I'll talk to you Tuesday. But sometimes you just need to know not to panic. But Mimico Medical has developed, as you and I have watched it do this, into sort of a center of well-being in the community. Not just doctors, but a center of well-being. Talk a little bit about Mimico Medical.
Well, it is actually a focus of ours right from the beginning. And our spectacular guest here today, Shelley Gorman, she was actually one of our first providers that joined us at Mimico Medical. So we didn't come in just with a focus on that medical degree. In fact, we also had Tara, our physiotherapist, as our first provider, really. So that was always a goal and a vision that I had when I founded the company. And Mimico Wellness Inc. is the official name of the company, and that's something recent. And so that's really incorporates what you're talking about. Is we're not just a medical clinic; we are an organization that focuses on overall wellness of our patients and our clients.
So this leads into Dr. Shelley Gorman, who joins us today. Hi, Shelley. Thanks for joining us.
Hi, I'm happy to be here.
Well,
yeah.
We're happy to have you in the community, and certainly part of the group with Mimico Medical, because it is part of a rounded health regime. I think having a psychology and psychiatric perspective on your patients overall. And what's your perspective on that, Tim? And then I'd love to hear how it all blends together from Shelley.
Well, as you know, and some of the listeners may not know, I'm a family physician. So, I try and take care of the patient overall. And I always go back to that old tenet, that triad of mind, body, soul. And, our psyche encompasses all three. And so I consider it to be probably the most important part of my overall assessment of a patient's current state. And I take it very seriously. I focus on it a lot in my practice, and I definitely try to find the expertise elsewhere so that patients can have a very well-rounded type of service and type of management plan, not just a treatment, but something that is what I term a management plan, a comprehensive, well thought out, well assessed, and well delivered type of plan. And Shelley's been a big part of that for us when it comes to the psychological aspects, which is truly an art in as much as it is a science. And she has so much experience doing it. So I'm very excited to hear her thoughts. And I'm going to learn a lot on this podcast as well today.
Shelley, what's it like being part of a medical practice from your perspective as one of the integral spokes in the wheel?
Well, it's a bit of a learning experience for me, although I've certainly worked in hospital settings. I think Mimico Medical is unique in many ways, and it's fun to be part of a group of people who are trying to bring good health to people in the community. And when I first met Tim, we talked about our perspectives on taking care of people's needs, and the mind, body, soul triad certainly came up in our discussion. And so when I greet people, I think about those three aspects. So being in the medical situation with the other doctors and so on, it's lovely because it's part of the 3 points on the triangle, so to speak, and I think we can support each other, which I think is really helpful. It's therapeutic for me to be able to be part of a community like this and have discussions and feel supported in my own search and work. And when we talk about things like mindfulness and psychotherapy, I feel that I'm being heard, and we're trying to expand the scope of services gradually for people in that practice, and psychology is certainly one of the areas. One of the questions that I think you brought up, Mike, was, what is therapy? That's an interesting question.
Yeah, I think that there's some misconceptions out there.
We need to sort that out.
Yeah,
I think
because
Shelley can help us with that.
yeah, Shelley, until you've done it, and maybe even if you have, you've not had the exact experience you expected. Therapy is not what most people think it is. In your pitch for what therapy is, what is it?
Well, it's kind of like self-soothing in a way. When people come with their problems and their dilemmas and so on, what they need is to feel heard. And I think the role of the therapist, as much as anything else, is to find ways to work with them so that whatever the pain they're feeling, that we're able to offer hope and some teach them some skills to deal with whatever the problem is. And so I like to think of making people feel comfortable and feel like they're getting some of their needs met in the therapy. It's not just intellectual discussion, but that they're actually learning to relax and be able to talk about themselves in an honest way, and that we're solving some of these issues together. The therapy is really a two-way street, and I learn from the clients. Everybody's different, and so it's an opportunity for me to develop my skills. I've been doing this for a long time, but I find that every new client is a new experience for learning and trying to figure out ways to help them help themselves ultimately. It's a chance for people to get to really know who they are, hopefully, and be more comfortable with who they are, and have an opportunity to bring that kindness to their relationships. And so
it impacts so much of our life. And even on the health side of things, I can speak from experience. If your mind is not focused on the moment, or you are distracted by anxiety or depression or anything, it impacts other places in life. So to be able to visit with somebody and get what I like to call a tune-up, a set of tools that you can use ongoing that you might not have otherwise had. And what is the actual experience like now? We are in the midst of a pandemic. Somebody needs therapy. What is the experience like for them?
Well, it's variable. I think a lot of people are very scared. I live in a condo, and we have what I call an elevator community. And I just noticed that over the last few months, people are more and more scared. Like when you stand in front of the elevator door and it opens, they look at you as if you're some kind of a wild creature. Are they going to let you in? What are the rules suggesting? So it's shifting people's sense of identity, and not only about the people that they encounter, but themselves as well. I think they're more fearful,
and you start to see this person suddenly that is wiping down the groceries, and you think, this is not me. How did I become this person? You're right. Our identities, even if we don't realize it, only in just marginal ways over the last year and 6 months or so.
Sure, and I think the social distancing has so much to do with that. People are afraid to speak out. They're afraid they're going to hurt somebody's feelings if they speak out to them. And I was talking to one of my own children today who was talking about the hesitancy that her kids have about saying hello to people. Yeah. And how are you? And that kind of thing. And it's putting a wedge up between people, which I think is very unhealthy in a sense.
And it's become politicized. I think even as a physician, you must have heard many different versions and opinions on what COVID was and how it impacts people's lives, when really what it was doing, it was creating a little bit of politics in our life we didn't have before.
Yeah.
Well, I don't want to get into that rabbit hole at this point in time, but I do want to highlight a couple things. Is this whole dichotomy that Shelley brought up between how we're going to live our our lives moving forward, and how we're going to direct our thoughts and our emotions, and really that dichotomy between hope and fear. And to your point, Mike, with the politicization and with the media machine that we now have in terms of the mainstream and the social, we are conditioned to veer more towards that side of fear. And I disagree. I think we need to learn to tune a lot of this out. We need to continue to live our lives the way our human nature directs us to. And we need to focus on being more hopeful moving forward. We need to maintain the hope, and there's very good reason to maintain hope. There's lots to be hopeful about. And so Shelley and I have talked about this, and we haven't gotten too technical either. We've focused more on the simple emotional feelings and aspects of someone's thoughts. And, we've come to the conclusion that this is something that we individually and collectively as a community or as a society can simply focus on together and start to reshift our mind frame moving forward.
Shelley, how do we begin to do this?
By smiling at each other.
By saying hi.
By saying hi, yeah, absolutely. It's like, how are you? And when we walk along the trail down by the lake, if people will look my way, I'll say hello, that kind of thing. And sometimes I have to push myself to do that, because when I look at people, sometimes they look like they don't want to look at me.
I know this, yeah. and I don't know that that's necessarily a negative thing they're trying to put out there. I think that we all are just trying to be polite. We're all trying to be courteous about our caution, and we don't know the lines anymore, right?
Yeah.
I mean, if you think about all the times in our lives we said hi or smiled at a stranger and they had a negative and abrasive reaction, it's probably, the exception, not the rule. So
Yeah.
we
Exactly.
have to go based on statistics and historical precedents and
Yeah,
let that rationality guide us.
Yeah.
But I agree, Shelley, it all starts with what we're doing in our day-to-day and what our facial expressions are towards others and what we're saying to them and asking them.
Well, we need each other in order to regulate our own internal systems. And so it's kind of a co-regulation. And I think that this is one of the problems with this social distancing, is that it's just not a natural thing. We want to be able to talk to each other and share. And especially, it's ironic in some ways, because during this pandemic, people have been feeling all kinds of things that they need to talk about and want to talk about, and even in the elevator. I had an experience earlier on this year, it was last summer actually, and I talked to a woman in the elevator, and I said, "How are things going?" And she said, "Well, not very well." And she's a school teacher, really friendly person and everything, and I was surprised. She told me, I said, "What's the matter?" And she said, "Well, my brother just died, and he died of COVID, and so you just don't know how important it is for maybe somebody to be able to be heard about something like that." And I saw her a few months later, and I said, how did things go with your brother?" And she said, "Oh, we haven't been able to bury him, and I need to make some telephone calls this afternoon to see what we can do about that." This was months. And so this is the kind of stuff that people are dealing with.
And that's nothing we've ever dealt with before, really. Losing a loved one and then so many months. So you're right. There's a million different plays that nobody has been through. And the playbook doesn't exist for this. But what playbook does exist is, the understanding of feelings. A therapist kind of helps unravel those, helps put the packages in the right place in front of you to see, I've noticed. And by the way, it's not an intrusive thing. I promise you, I've been through it. The other side of it is, I think that you come away from your experience ready to be a better human with other people. So as we re-enter society as a group, you're going to be better prepared, rather than living in a pool of despair that you have, or fear, or whatever the emotions were that you sat in for so long, probably a good idea to get out there and do a little bit of a mental workout, I think, and get ready.
And I would extrapolate that to people who have found that they've struggled mentally and emotionally pre-pandemic and before the pandemic even started. And maybe the pandemic's made it worse. Maybe it's made it better. Who knows? But at the end of the day, everything we're talking about is pertinent to our lives pre-pandemic in certain cases.
Shelley, I'm going to ask you because I think you've probably been doing this, 15 years now? 20 years?
40.
40 years. Okay.
Very
Almost
smart,
40.
Mike. Very smart.
But I think what's worth talking about here is experience. Because when somebody has been in the field that you're in for a period of time, maybe it wasn't a pandemic that you helped people through. It might have been another crisis that was en masse.
Tremendous number of crises.
Right.
Yeah, I worked in the correctional system for a while, doing forensic psychology assessments, and worked at an alcohol counseling center and was the director of the Peel Center for Addictions that we had. And so crisis after crisis after crisis, but...
And here you sit, ready for the next crisis to arrive. And I guess my point is that experience lends itself to having, making it relatable.
Yeah.
And right there, to have somebody who can relate.
Yeah.
That's therapeutic in and of itself.
I think so. And so many people have experienced all trauma of one sort or another. And we have to be sensitive to that in our work, of course. And some of our work is really trauma-focused. And, we do what we can, But when people come to see me, one of the things that I think about is that but the body-mind-spirit connection. But I look at them, I try to see them as beautiful. That there's something in the core about them that's beautiful, and let's try to reach that in one way or another. And if they can feel that they're being regarded in a positive way, I think that helps a great deal,
A bit of momentum with positivity goes a long way. You can build on that. If you're sitting in the hole by yourself, you can't really build on that.
No.
Well, listen, could we do this? Would you both mind coming back, doctors, and talking more about this with some specificity? Things like family, couples therapy, young adults, that. Let's drill down on some of these things, and let's get people comfortable to get taking care of themselves in this regard. What do you say?
I say it's great because we need to look after each other. This is what I feel, and this is one way to do that.
I think it's a good plan, and it's great for the Etobicoke Lakeshore community. It's what's going to allow our community to become more resilient if we just start to slow down and focus on ourselves and our closest loved ones, and really just have compassion for ourselves and for those loved ones. And it's okay to feel sorry for yourself. And when you do, that's an indication that maybe it's time to tap into some of those inner emotions and feelings and insights.
And to come to Mimico Medical.
And to come to Mimico Medical to see one of our great family doctors, to let them know that something is on your mind and there's something you need to let go. And they are all very in tap with this aspect of our care, and we have such an experienced and wonderful and kind-hearted resource in Shelley to sit down and really start to tap into those inner workings.
There's a great vibe at Mimico Medical. I've had the opportunity to meet many of the people that are part of the operation, and now Shelley, no exception. I promise you, you will be welcomed into a place that is built on good vibes and love, and you will be well taken care of. If you want to reach out to Dr. Shelley Gorman, psychologist at Mimico Medical, 416-201-0836. I'll do that again so you don't have to rewind. 416-201-0836, and you can check them out at mimicomedical.com. You are an awesome resource, Doc. Thank you so much, Dr.
It's a pleasure
Tim.
as always, Mike and Roger.
You know, Roger,
Thank you so much for joining us.
it was a good idea when you said we got to get a doctor behind us because we could be in trouble otherwise. And look at this. He's been the most incredible resource. By the way, I remember one of the questions that you were first asked about the pandemic, and we asked you, "Well, is this the end of the handshake?" And your response was something along the lines of, "We'll find another way to say hello, I love you."
Right.
And it was that attitude is carried through the pandemic. I see you here with that same smile on your face. So delighted to have you both in.
Yeah.
Roger, thank you, my man.
Thank you, Mike.
I will encourage you to check out the Etobicoke Lakeshore Press at etobicokelakeshorepress.com. It's there in a digital form. This podcast is available anywhere you listen to podcasts. Joe Rogan's got nothing on Roger Tuminieri. Thanks for joining us. We'll catch you next time.